Welcome everyone to the webinar, Taking Action on Teen Vaping. I'm Dr. Jennifer Salerno and I will be joined today by Ann Hughes. We're excited to have her with us. So before I begin, I have a few housekeeping items. Please view the presentation in full screen mode. Some of the fonts or images might appear small, and full screen allows you to see everything that we're sharing during the webinar. We'll be answering questions at the end, so please use the question box throughout. You should see that in your GoToMeeting panel, and we will come back to that and answer all of the questions at the end. You may have questions for myself or for Ann, so you can use that question box for both. So thank you for joining us today. First up, we will be providing an overview, kind of discussing what's happening with youth nicotine and tobacco use, some of the risk data, and the why behind the development of the Act for Nicotine and Tobacco. We'll introduce the technology, including a brief demonstration of the system. And then we'll be joined by our guest speaker, Ann Hughes, who will share her experiences using the Act for Nicotine and Tobacco as a clinical provider, as a nurse practitioner within a busy school-linked health center, and as a component of an education program for students that have been caught using tobacco or vaping on school grounds. So we're very pleased to have her join us today. So welcome, Ann, and you'll hear from her towards the end of the webinar. So I know this image is a little bit blurry, but I'm hoping that you can view on full screen, take a look at kind of the colored bars. It is from the National Youth Tobacco Survey, and what it's showing you is youth use of cigarettes and e-cigarettes or vaping over the last 8 years, between 2011 and 2019. So you can see that cigarette use has really declined and vaping has just shot up past even where cigarette use was at its highest. So taking a look at this information, you can see that in 2019, just over 5% of youth reported cigarette use, and nearly 28% reported e-cigarette or vaping, almost double that of cigarette use, even when it was at its highest in 2011. And we know 1 out of 4 U.S. youth report vaping. And some of the reasons that vaping is so enticing to young people is that it really was kind of marketed as being less harmful than smoking. So that's the first piece, and has a lower per cost use than traditional cigarettes, especially when youth are using their devices outside of the manufacturer's suggestions. So they may be refilling disposable cartridges, things like that. And also the flavorings. So I know that you've heard about all the different flavorings that appeal to all age groups of youth and teen interests. So some of the names and flavors like apple pie, watermelon, they have Bazooka Joe bubblegum, and even something called zombie blood. So those are just a few examples of the way that they may be kind of drawing in youth to try those different flavors and or types. And what makes it even more difficult to identify and more appealing to youth are that vapes are easy to hide. There's lots of ways that vapes have been put into cups. You can see an image here from the American Lung Association where it looks like the vaping device is a straw, it's in a marker, it looks like it's part of a phone or mints. So that can also be appealing to youth. So as you know, they like to, if they're engaging in a behavior, maybe not have it as a parent or feel like they are getting away with something. So all around marketing has really targeted youth, those pieces of youth development that can really get them interested in using the devices and in vaping itself. So with the high rates of lung damage and death over the last 6 months, particularly in youth and young adults, the American Lung Association has put out some really strong statements. You can see that here. Do not use e-cigarettes. They're not safe. The chemicals found in e-cigarettes and vaping can cause serious and irreversible lung damage and disease. And if you are a user and experience any type of adverse health effects, particularly respiratory symptoms, that you should seek medical attention immediately. So when talking with youth about risks, you want your message to be clear and concise. We know that just telling teens don't do it doesn't work. That would be great. Our jobs would be so much easier if we could tell teens about risks and not to do it, and they would kind of follow along with that. So what is the information that we would really like teens to know that may be most impactful to teens? And remember, the attention span of youth, especially if you're providing information that they didn't ask for, that you want to make sure they know, is about 30 seconds. So you want to make sure that your message is very clear. So there are 3 areas that we feel are important that teen kind of know the risks and have the information, the most up-to-date information. The first is really related to their lungs. So 2/3 of youth vaping didn't realize that they were using nicotine. They thought that they were using water, that it was just water vapor. So really important that they know that there's chemicals in the vapor, and that can cause burns to lung tissue, serious lung damage, and death. I think that message has gotten out there over the last few months with all of the news stories and information, but you'd want to make sure that they had that and they knew that piece. The next part is really around brain development. So the nicotine in the vapes and, in cigarettes as well, can really slow brain development and affect memory, concentration, learning, self-control, attention, and mood of youth. So they may be experiencing some of these different effects and not realize that it really is related to vaping. So you may ask youth a question like, what have you experienced since you started vaping? When you give them that information. So they start thinking about it like, oh, maybe some of these things are related to this risk factor. And then the last piece is really about the addiction, that vaping is highly addictive. The levels of nicotine in vape are much higher than in traditional cigarettes. And some of the most recent research suggests that nicotine in vapes may be as addictive as heroin and cocaine, which is very scary thinking about the amount of youth that are vaping. And then using the extra strength cartridges or increasing the voltage puts youth at higher risk because they're getting even more nicotine. So what are some of the challenges to identifying those youth in need, especially because vaping, there's lots of devices that they can hide it. They're pretty much vaping everywhere, in schools, at home, when they're out with their friends, and adults sometimes don't know that that's happening. So how do we identify them, and then how do we help them to disclose that information to us and provide what they need? So the first piece is really to engage them in that conversation about risks, in understanding how much they're using, and that they would be honest with us, that we have a process for that that's standardized, whatever the location is that you're providing services, that you have the tools and resources that you need, and that you have the time to provide those. So some of the newest recommendations from the Centers for Disease Control around clinical settings. So if you're in a clinical setting and you're seeing youth, the recommendations now are to ask all youth about tobacco and nicotine use. And then those youth that report vaping within the last 90 days to ask about respiratory symptoms. In addition, to obtain a detailed history that would include their frequency of use, the source of their liquids, of their devices, where are they purchasing those? So is it online? Is it from another student maybe in school? Is it at a reputable store? And if it is, then they would be of age. What devices are they using? What is their method of use? And are they sharing products with others? So at that point, they may not know the answer to some of these questions if they're sharing products and they didn't actually purchase them. Some of the recommendations for school settings, particularly those youth that are being identified as vaping or that they are concerned about vaping, maybe they're not identified, but they know it's happening within the school, is to try to reframe from discipline to providing support. Of course, there is going to be some type of discipline related to breaking the rules in school settings, but how are we supporting those youth that may be addicted and providing them with some resources to help them continue to not use? You may look at policies, updating the tobacco-free school policy to include any tobacco or nicotine product for any person, any time, any location on school property, and at any event. So if that's not already part of the policy, to take a look at that. And then to screen students that are caught using tobacco or nicotine and support cessation efforts. So are there ways that you can partner in the community, partner to provide resources or support, and then refer to services, additional services as needed, and offer some alternatives to suspension. The other piece of this is really around parents. So how are we supporting parents to help their teens to reduce or quit using when they know that that is the case, or to talk with their teen about vaping in general, and providing some ways that they can start the conversation and continue that at home. So the next piece within this webinar is really talking about technology. So how can we use technology to support some of these recommendations? We know that technology removes variability. So how we look when we're asking questions is really important. Youth will feel judged sometimes in how we look when we're asking, how we ask the question. Commonly, youth are asked a question leading them to the answer that we want to hear. Something like, "You're not vaping, right?" Instead of asking them what they think about vaping. And then how we talk about risky behavior. So we know just say no doesn't work. So how are we bringing up some of the risks and then asking them what they've experienced or what they think about that would be really important. And then technology really helps to connect you with teens. We know that teens use technology, they've grown up with technology, and that's what they're most comfortable with. So if you look at the literature, using technology increases their honesty. You identify more risks that may be impacting their use. So their use of nicotine or tobacco might not be just because their friends are doing it. Maybe they're feeling stressed. Maybe it helps them with depression. Maybe there's some other pieces that would be important to identify to help them stop using. It also gives you better outcomes and data to look at your population as a whole, what the trends are, if you've been able to change that trend to improve behaviors over time. And then you also can use the information for reimbursement or for grant funding. So depending on your setting and what you're focused on related to youth and nicotine, and if you need to report that, you can use technology to help you with that piece. So the ACT modules really act as a virtual health educator. So it provides youth with interactive, evidence-based risk behavior counseling and assessment. So we've really kind of taken that technology, the teens, along with expert collaboration to get this transformation around identifying risk and providing that coaching, leading youth to safer behaviors in reduction or cessation. And ACT supports professionals. It was developed to support work with youth in schools, primary care, school-based health centers, hospitals, youth-serving organizations. And there's lots of different ways that it can be used. It was really based on behavior change methodologies that have been proven effective in adolescent risk reduction. So the trans-theoretical model for change or behavior change and motivational interviewing. So when youth go through the technology-based module, they're being asked questions, but they're also receiving information at the same time using the strategies within motivational interviewing. So it was really designed to be a standalone intervention or to work hand in hand with a clinical provider as part of a clinical visit. It standardizes that kind of risk reduction for youth. It ensures a consistent implementation of current screening guidelines and counseling recommendations, provides some comprehensive documentation individually if you need that piece. And like I said, it can be a standalone tool or used as part of a clinical visit to reduce that face-to-face visit time and burden on providers. So some of the innovative features for the youth and young adults is that it was really designed to engage them. Any of the technology-based products that we have been based in getting youth feedback, and not just on the look and feel, but also on the way that the questions are worded and how they're worded and what they look like in order to engage them. So we know technology helps with that. It's typically completed on a tablet, an iPad. Teens can also use their own smartphones. There's an audio option for teens to listen to the text that's being provided throughout the assessment in both English and Spanish. And then they will receive some health education as they go through and answer questions, but also at the end. So I kind of will show you what that looks like. So the ACT includes three critical components. The first is an assessment of risk and behaviors. So they will, on a tablet, say, complete the assessment and receive information back. It takes them about 7 to 10 minutes to complete the assessment and receive the information or health education. At the same time, they're getting some risk coaching, and at the end, they end up with an action plan for change. And then lastly, they can choose to continue engagement through text messaging. So this is an example of the look and feel. When we worked with youth, they asked for an image next to each of the questions to keep them engaged. They also had a lot to say about the font, the colors, how the questions appear. They only wanted to see one at a time. So you can see that. And then where the arrow's pointing is where they can click and listen to the text that is on each one of these screens as they scroll through. As they answer some of the questions, they'll get feedback based on some of their answers. So this is an example of some of the information they may receive when they disclose that they have been using a vape or e-cigarettes. And then this is just another example of the way that questions will appear. So it's not always select all or yes or no. We're asking, using motivational interviewing, questions about their readiness to change, and also when they are creating a plan to cut back or to quit, their confidence, because we know that that is a big factor in indicating whether they will be successful. So when you know how confident they are, then you can help them in maintaining that level of confidence or improving it when you're looking at their action plan at the end, if you're using this as part of a clinical visit. If not, then the system provides as well information for them if their confidence is low in ways to overcome challenges. When they complete the assessment, they see this tailored action plan for reducing or quitting use. If they are not at a point to make a goal to reduce or quit, that piece will not appear, but they still will have what would motivate them and what they would need. So when you're working on an action plan, you want to, or you're working on a behavior change, you want to get to a goal, but you may not always be there based on your stage of change and whether you feel like that is something you're committed to doing right at the moment. If there isn't a goal, you're still planting the seed, you're still providing information. So you may have a goal like you see here, you're ready to cut back in using your vape. The second piece is what will motivate you to continue to do that. Why are you doing that, basically? And the third is, what do you need in order to make that work? And those are very critical pieces when you're helping someone to continue down the path of a behavior change. The next information that youth will see is very tailored to how they responded within the assessment. So they'll have some information around the use of the products that they identified, also kind of planning ahead for times that they feel like they might be in challenging situations and what they felt like they could do to overcome that. If you're using this as part of a clinical visit, you would have that piece as well so that you could review it with the youth, or as part of a program that you might be working with youth individually, you would have those pieces to help keep them on track as a support person as well. And then they are provided an opportunity for continued engagement with text messaging. So the text messages they receive more in the beginning and spread out towards the end of over a 3-month time period. So this is an example of one of the text messages they might receive. They are tailored based on how they responded to questions within the system. So it's very tailored to that individual youth. There are lots of other text messaging opportunities that different organizations have developed, particularly within the last 6 months with this large increase in vaping. We provide an opportunity for youth through text messaging here to also enroll into some of those more robust programs, because this text messaging is very specific to a goal and plan for that youth. And some of the other ones have a larger, broader base of education and messages that could be sent over time. So they have the opportunity to enroll in those as well. So some of the preliminary information that we have pulled from the system, based on nearly 600 assessments that have been completed over the last 2 years in some pilot projects, we see that 84% of the youth that are using the technology opted in to receive health education as they were going through and answering questions. So they do have an opportunity to say yes or no to that, which follows along motivational interviewing theory as well, and asking permission, and provides them with more opportunities to kind of receive information, and that they would be more open to receiving it when they agreed to it. Everyone gets the information at the end, whether they agreed to receive health education throughout the assessment or not. 64% created an action plan to reduce or eliminate the use of nicotine or tobacco, which we thought was a great number. And then 42% opted in to receiving that text message follow-up. So they received text messages over a 3-month time period to support their cessation or reduction efforts. So some of the features for professionals that are using the ACT nicotine and tobacco, it does have a format that will provide documentation for you of that history of use of nicotine or tobacco. It was developed in a way that you could save it as a PDF, use it as part of an electronic health record, as part of a visit, and put it into any type of other system or save it within this system as the opportunity to review each individual youth that completes the assessment, their specific history. The education and risk reduction counseling is provided through the technology, so it really helps support the youth, and if you're using it as a clinician, it supports the work that you're doing there. It can help integrate services, so in a referral manner, you can assign it to another person, maybe in your organization, to do some follow-up. You have very easy access to the data and saves you time in having to have the ability, the time, the skills in order to talk through with youth about their motivations, what they would need in order to quit, what are some of the challenges. You have that as a starting point, which really allows you more time then to make sure that they feel confident and they don't need anything else related to their reduction efforts. This is an example of the nicotine and tobacco history that you may see from an individual youth. You'll see what their top item was they identified, how often they're using it, and then some of the additional questions related to if they're having symptoms, respiratory symptoms or illness, what kind of devices, and where are they obtaining their liquids? Have they ever tried to quit? And what stage of change are they in for reducing or quitting use, and how hard do they feel like it would be? So this is an example of a documentation that you could save as a PDF. Some of the initial results, the data presented here is really based on our work with professionals in creating the Nicotine and Tobacco Act and the subsequent use. Currently, we're funded by NIH to complete a more rigorous review of the effectiveness of the Act, and those results should be available by early summer of 2020. So some of our initial results, providers say that the Act reduced time to assess and coach on reduction, and it enhanced care related to their use in clinical practice, and that it was easy to use and incorporate into workflow, because that's one of the biggest challenges that can arise. Among teens, they reported that it assisted them in reduction or cessation, and when we looked at the data in the system, 50% of youth reported vaping reported steps to reduce or quit using. And then over time, we had a 34% decrease in the use of nicotine products a month after they were seen and completed the Act, and then continued with a 44% reduction after 3 months. So we're very excited about our initial results and looking forward to completing the NIH project and really seeing some stronger results by summer of 2020. So how do we utilize some of the data that is available within the system? We don't always have time for that. What do we need to know is first. So if you are a clinical provider, if you're in a school, if you're in a youth serving organization, what do you need to know about your population? These are some of the common questions. How many assessments have been completed? What are the greatest risks in my population? And who is it that is at risk? Who was completing the nicotine and tobacco module? What does that demographic look like? So this is an example of what some of the reports look like, how many assessments have been completed. You can take a look at that over time. What are the greatest risks in my population? You can see out of the youth that completed the ACT, nicotine and tobacco, all of the questions and responses. So what are the products is the example here, and what did youth say that they wanted to do? What would be their first step in either considering quitting, cutting back, or maybe they already have started it. So it can give you an idea of where youth are when they come to see you or when they get in trouble, depending on how you would enroll youth into your program. And then what is the demographic makeup? So you'll always have a chart and then some type of graph, pie graph or bar graph that would give you an idea of the makeup of your population. So the ACT was created to get honest, consistent data in and then give you actionable data out. So whether that's on an individual level or a population level. We get a lot of questions about pricing. So ACT starts at about $100 a month. And all of the technology that we offer through Possibilities for Change is priced low compared to other technology, other things that you may use to incorporate into your services. We're really focused on that social impact of improving the health and well-being of youth. So we'd be happy to provide a price quote specific to your organization. There's a link in chat that you can click to request a quote, or you can go to our website if you want more information. And this is some of the pieces that are included in your use of the system. So we provide a lot of support to make sure that you're using it to all of the features that would be important for you, as well as getting the information that you need out. There's some billing codes for focus screenings that are listed here. So if you're in a clinical setting and do billing, you can add some of those codes to your visit. Also with HEDIS payments, you have bonus payments available, different times, different years, particularly around including this type of assessment in an adolescent well visit or a tobacco screening. So now I'm going to turn it over to Anne to share some of her experience and lessons learned in using the ACT.
Okay. Thank you so much for inviting me to participate in this, Jen. It's been really a good experience working with the new module. Our clinic is the Youth Health and Wellness Center, which is a school-based health center in Traverse City, Michigan. We are on the campus of what's called a Career Tech Center, which is a vocational school. And we draw from 25 area high schools in a 5-county area. There are about 1,200 students who attend this school. We also have an alternative high school nearby, and we serve that population as well. It's about 170 kids. So we've been using the RAPs for probably a decade and find it immensely valuable in terms of uncovering risk factors for our students. And we were really happy to participate as a beta site for this ACT assessment tool for nicotine and tobacco. So what we found in terms of clinic flow was that we use a tablet for the questionnaire, and it goes quickly. I mean, the kids, when they're sitting in the waiting room or sitting in the room waiting for us, they're completing their assessment. We can see it. They are sometimes surprised that we can see it. It's interesting. We've had feedback in the past that I think they thought their answers were just going into cyberspace somewhere. So it's a real opportunity for us to go over the concept of confidentiality with them, so that they understand that it's for us to talk about. We don't share it with their school. they are extremely honest with this method of data collection. It's shocking sometimes. And they are also much more kind of uncorked. So when we go in to have a discussion with them, it's like the toothpaste is already out of the tube. They are very open in the follow up, um, what we have to say. They tell us more and more as the conversation goes on. So that's really been interesting. I don't know how much of the education they actually read, but the module does provide them with education, and that is helpful to us because they get tired of listening to us uh, spout our advice. And so I think that they're much more willing to have that come in the form that they're familiar with, which is online. It's how they study, it's how they work in school. And so it's really helpful to have it presented to them in that way. They certainly consistently tell us they don't read pamphlets and handouts, so we're happy to have it based on a web-based program. So what we observed in these tobacco assessments were that we had more students telling us that they were reducing their use, more students asking us about quitting, particularly at the end of the school year. We prescribed a lot more nicotine replacement therapy at the end of the school year. We've been using this program for about 2 years, so we've got a little bit of history with it. After summer break, unfortunately, a lot of them had resumed use, which wasn't particularly surprising to us. So in that 2-year time period of using this, there's really been the explosion of the use of vapes. And since we're on a vocational school campus, they have very strict rules about the use of vaping because they have no way of knowing actually what's in the vape. So their concern was that students would be vaping THC, they would become impaired, and they're using equipment that they could damage themselves or other students. If they've got a car up on a hoist, they can't be impaired. So this school's policy was an automatic 5-day suspension for the second time that they were caught with vape equipment. That's a long time to be absent in a vocational school. So our target school actually reached out to us. It was a really great collaboration with our target school. They asked us to provide health education so that they could reduce that punitive measure. So we added a health education component in addition to what was in the ACT. It was for being part of the beta study, we had to have the kids come back for 3 visits. So they had to complete 3 visits in a 3-month time period. So that's how we set up the program with this school. So they would come in. We had a series of initially it was PowerPoints, and then we found that didn't work as well. So we began using YouTube videos actually to do some of that education and open up some dialogue. And that was actually a really effective tool for the school. They were able to, they reduced their out of school suspension took it down to 2 days, and they would complete their 3 visits with us. After that occurred, we started reaching out to other high schools in the area who then started referring their students to us to shorten their out of school suspension time. One of the things we noticed about that was there was some variability in the way consequences were implemented. So those of you who are working in schools, that was very frustrating to students. They kind of didn't know what to expect. They didn't understand why their friends were having different consequences than they were having in terms of their reduction of punitive measures. In addition, parents then became interested. They heard about the program, and the problem was getting much more national press, and so people wanted an option to educate their child or their students. So we had a fair amount of referrals over the summer for this education program, which we did modify over time, and it's become a little more interesting to the students. We're getting a little bit better feedback from them. We've utilized the tobacco module as a starting point now and a finishing point, in addition to the education module that we use for that particular collaboration with the school. In terms of ideas, things that we would change or would like to do in the future, some students, not students at our school, but students at the Adolescent Health Initiative Conference, told us they felt that group education would be really effective. So we did approach our target school about modifying the program for youth or group education, which we haven't yet implemented, but we're kind of excited about trying that. So they would take the wraps individually, and that would be reviewed individually, but the education piece would take place in a group. We'd also like to do a lot better job of outreach to parents and using our website and some other modalities like Facebook and other social media to reach out to parents and get education resources and other websites that they can access for information, and also including program specifics so they know what their kids are learning from us. In terms of data from our use of the ACT program, the RAPS tells us that 30% of our students in our clinic use tobacco products. Of those 30%, 87% of them are vaping, 30% are using cigarettes. So vaping is by far the larger problem. When we looked at our data at the end of the 2-year period, we had 97 students be triaged into that group that were using tobacco products. Only 22 of them completed all 3 sessions, but it's difficult sometimes to get people to come back for all 3 over the summer. Lots of reasons. But of those 22 who did complete all 3 sessions, 64% of them showed a decrease in smoking and a change in their stage of change. So that was a positive outcome. I would say that in terms of looking at the data collection for the ACT tobacco module, I really didn't look at it very much. I was just thrilled to have a tool that could evaluate tobacco use, evaluate nicotine use, and educate about that, and it kind of ran itself. So that was a very positive thing for us as clinicians. Office managers and supervisors, of course, have access to various information in the program, and those last little bit of statistics I was actually given today by our clinic supervisor, because he went through and got all that out for us, and he got it out because it's part of our grant, and so we were able to use this ACT module to meet the conditions of our grant. So it was really helpful to us. So thank you.
Great. Thank you, Anne, so much. And if you have questions, make sure you type them into the question box, because Anne will be available to answer any questions you have as well. So our final slide is really just a call to action for you, like championing youth screening and cessation in your organization. What does that look like? Staff that are engaged in really supporting youth that are using nicotine and tobacco. How can that happen? What does that look like? That those at-risk youth are provided some resources, because they may be addicted. They may need help. Like Anne was sharing, some nicotine replacement therapy or some group education or some group cessation could be something that helps them overcome this at an age where it wouldn't then continue into adulthood. and that you're able to use kind of that individual and population data to support the work you're doing, whether you have a grant or not. It's always helpful to support and provide that information to your board of directors, potentially school board, people that would be interested in the work you're doing to improve the health and well-being of youth that you're serving. So that's the information that we have for you. Thank you for attending the webinar. I'll look at some of the questions that we have to respond to those. If you want more information, definitely go to our website. You can download a preview document that provides some more detailed information around the Act for Nicotine and Tobacco Use, some of the questions, some of the health education. You can go to our website and download that. Also, there's an attachment to the webinar that if you open the webinar panel, there's a handout there that provides you some more information as well. So it looks like there is a question around consent. So the question is, were there any consent or HIPAA requirements in working with adolescents? And I can let Anne answer that as well. But in general, when you're working with adolescents, and if you're talking about HIPAA, I'm assuming you're talking about in a clinical setting, that you would have a consent for services that you're providing, those clinical services. And depending on what state you're in, you will have some type of minor consent laws around seeking services related to substance use. So that may be a minor consent, or you may have a parent consent as well related to that. I don't know, Anne, if you have anything to add.
Yeah, we actually we had both situations. So we had when we use the wraps for someone coming in for a clinical visit, it is considered it's a confidential service for us. I mean, we abide by the limits to confidentiality of suicidal ideation or homicidal ideation, but in general, that we have students sign a minor consent form when we're working with that confidential risk assessment. So some of those kids, that was a totally confidential service. They wanted to quit. They didn't want their parents to know they were smoking or using a vape, and that was something we could do confidentially. The ones who were referred from the school, however, their parents were involved, and it was that we were working off the regular clinic consent for treatment. So it was both ways. But we always had a consent for treatment, and yes, HIPAA applies. And we did a lot of tap dancing in terms of trying to figure out how we could communicate with the school that they had completed the 3 visits, because HIPAA would be an issue there. So what we ultimately did was we created a letter that we would hand to the student, and the student would take it back to the principal. So the student was actually delivering the information, not the clinic.
Great. I have a second question that says, I may have missed this, but how do we get a hold of the ACT technology? So if you reach out, there is a link in the chat or the question box for more information. We would be happy to send that to you to talk more about the process. And at this point, I don't see any other questions, but please feel free to reach out. If something else comes up, download the handout that is available in the panel. And I thank Anne again for joining us and sharing her experiences. I really appreciate that, Anne. And for everyone else, have a wonderful afternoon, and let us know, reach out. We can answer any questions you have related to the vaping information that we sent, and also the ACT nicotine and tobacco.